No infectious diseases?
Nope.
No systemic diseases?
Nope.
No medications?
Just vitamins.
What type of vitamins, do you know?
Just the multivitamin.
Okay. Do you take that every day?
Usually, yeah.
And no allergies?
Nope.
Perfect. Alright. Looks like you're pretty healthy. You're brushing your teeth 2 times a day?
Mm-hmm.
Perfect. Are you flossing at all?
Yeah, usually like once or twice a week.
And I see that you circled that your gums bleed when you brush.
Yeah.
Is it every time or is it in certain areas?
Just sometimes, like on the upper right.
Okay, and about how long has it been since you had your teeth cleaned last?
2 years.
Perfect. All right. First, I'm gonna grab your blood pressure, okay?
Okay.
And uncross your legs for me. Perfect. Looks good. And do you remember when your last dental x-rays were?
At least 2 years ago.
At least 2 years ago. Do you have the dentist name that you had your last x-rays taken at?
I can't remember the name.
Okay, so we'll probably just take a couple bite wings today since you had some a couple years ago.
Okay.
So I'm gonna walk you over to this room right here and we'll do that right now, okay? Perfect. All right, I'm gonna walk you back over to the chair, okay? All right, next we're gonna do the extraoral exam just to make sure your lymph nodes aren't enlarged or anything, okay? And open for me, and close, and open, and close. Perfect. All right, I'm gonna have you throw these on for me. I'm not putting them. Go ahead and open. And stick your tongue out at me. Perfect. Next, the doctor's just gonna come in and she's gonna do a quick exam, okay?
Okay.
Hi Sarah, my name's Annie. How are you today?
I'm good. How are you?
Do you have any pain?
No.
And are any teeth bothering you?
No.
And can I see the x-rays, please? Yes. Can you scroll over? Okay, thank you. Next one. Okay, can you go up to that image for me? So I didn't see anything on the x-rays, but we do have to look intraorally. So if you'll open for me. And all I see is a small buccal pick on your upper right tooth. And Haley can talk about keeping that clean for you.
Okay.
And I do recommend composite material. It's the one that's the tooth colored.
Okay.
And what tooth number is that?
Tooth number 14.
Okay.
Buccal pick. Thank you. All right, and then Haley can go over the dental treatment for you.
Okay.
All right, thank you, Sarah.
Thank you.
All right, so it looks like she just recommended one filling on your upper left. And we can do that at your next visit, okay?
Okay.
All right, so next we're just gonna take some measurements of your gums and just see how deep the pockets are, okay? 2, 1, 2, 2, 1, 2, 3, 2, 3, 2, 1, 2. All right, so your pockets all seem pretty healthy. There's a little bit of an irritation up on your upper left between your molars.
Okay.
That might be one of the areas where it bleeds when you brush. And then also you have a little bit of buildup on your lower anteriors, probably because you have a lingual bar. So one thing that I would recommend is, it's called an in-tuft brush, and it's just like a toothbrush, but it has a smaller head, so it makes it easier to access that area.
Okay.
So I'll kind of show you how to use that. Go ahead and grab that mirror for me. So if you angle that kind of just like this, it has a smaller head, so it makes it easier to access back here and just go up and down like that. Does that make sense?
Yeah.
Perfect. All right, so I'm gonna go ahead and sit you up. All right, so I'm just gonna kind of go over the treatment plan with you, okay?
Okay.
So do you have generalized slight calculus just because you haven't had your teeth cleaned for a while? You have a little bit of recession, so that kind of can add to the sensitivity and it kind of attributes to the loss of attachment.
Okay.
So I would say that you're a generalized case type 2, which is slight periodontitis. It just means you're in a good place to get everything taken care of so it doesn't progress.
Okay.
Do you use fluoride at home?
Yes.
In your toothpaste?
Mm-hmm.
Perfect. And you said about 2 years since your last cleaning?
Mm-hmm.
All right. And what are your goals for your teeth?
I would just like to have them clean and whiter.
Perfect. We can also talk about whitening. We have different options. We can make bleach trays for you if you're interested in that, and we can talk about that later also.
Okay.
All right. So we already did the exam with the dentist. We're gonna go ahead and clean your teeth. We take your x-rays, and I'd like to put fluoride on afterwards if you're okay with that.
Yeah, that's fine.
I just need your signature right there. Perfect.